Successful man, New York guy, employed a lot of people. They're all crying over his death. Stanley Shearer.
Stanley Shearer. Yes, the president has lost a very good friend to the COVID virus. A lot of folks talk about the president lacking empathy and sympathy. That is not true. Good man. A lot of folks knew him here in New York. Dr. David Samadi actually wrote about him recently for Newsmax.com, and he's got a lot to say about hydroxychloroquine. Doctor, welcome back.
Good to be with you, Greg.
Tell me a little bit, first of all, you wrote about Mr. Shearer and hydroxychloroquine. The hydroxychloroquine overreaction. People just don't get it regarding this drug.
I think the fact that they're making this drug into a big political football, it's completely uncalled for. And it was amazing that within seconds, the mainstream media came on an attack and how irresponsible the president was. And it's completely not correct and not true. If you look back at how he lost his friend, Stephen Shearer, the fact that one of his allies in England came so close. Boris Johnson came within inches of being on ventilation, and we know the outcome after that. And we have had two staffers in the White House that were diagnosed with this. A discussion between the medical team in the White House and the president has happened. And they have looked at the risk and benefit. And in medicine, when the benefit outweighs the risk, is absolutely the right way to go. And this is the kind of medication that we don't really need to discuss. There are many studies from National Institute of Allergies and Infectious Disease to 3,000 volunteers at Henry Ford and many other studies that have shown there's a benefit when it's given at early stage. It reduces hospitalization, it reduces death, and also the number of days they'll be on ventilation.
So, doctor, let me ask you this. Who should take it, or who should have a conversation with their doctor about taking hydroxychloroquine? The president is a big endorsement here. So who out there should be pursuing this?
You cannot take this voluntarily. If you have been exposed and you're starting to have symptoms, or if there's any question about this, a discussion between a patient and a doctor has to be made. We have to look at the overall picture. One size fits all is not going to work. They have looked at whether he has high cardiac conditions or not. So, and every patient, the art of medicine, Greg, is to really individualize the care and see if that works for the patient. So there has to be a discussion between the doctor and the patient. And the government has to stay completely out of this relationship. There's no room for it.
I like that a lot. And the president has one of the best doctors in the world. I don't know who it is, but I assume he's a very good naval physician there at the White House. Dr. David Samadi, also one of the very best in the world. Thank you very much. You can find him at St. Francis Hospital, the director of Men's Health. To be continued, Dr. Samadi, and thank you.
Good to be with you, Greg.
All the best.